Hello, everyone, and welcome to the Long COVID Healthathon closing event. My name is Ann Buechner. I use she, her pronouns, and I'm a Senior Director of Design at Coforma, which, along with Ensemble, is one of the partners to the amazing team at the Department of Health and Human Services supporting this Long COVID Healthathon. I will be your MC for the first part of today's event. We are so thrilled by the enthusiastic engagement with this Healthathon. Whether you participated by submitting an idea, a proposal, or a prototype, are a finalist, judge, or speaker, we want to extend a big thank you to all participants for your dedication and hard work to improve the lives of those affected by long COVID. And today, we're here to celebrate the ideas and hard work of our finalists. Before we dive in, this session is being recorded. Everyone has been automatically muted. The video for this will be uploaded to the news and announcements section of longcovid.creditcity.com for your reference. Felipe dropped that link in the chat. And you do have access to emoji reactions, though, which I hope you'll use to celebrate our finalists, winners, and speakers. For today's event, we'll be covering the following. So we'll do a quick recap of the Healthathon. We'll introduce the Healthathon finalists, announce our Healthathon winners, and then we have some amazing speakers lined up for you, including Dr. Susan Maneras from the Advanced Research Projects Agency for Health, and Kristen Honey from the Department of Health and Human Services. Let's do a quick recap. Some of you in attendance today might be here to support and celebrate the hard work of a colleague, friend, or loved one, and you might be asking the question, what is a Healthathon? Health-focused innovation events with hackathon roots, bringing together a diverse community of problem solvers. Healthathons transform insights from people's lived experiences into the design and development of new solutions with real-world impact, and, in the case of this Healthathon, support the long COVID community today. Healthathons are often focused around a problem statement or goal framed as a question. The central question this Healthathon sought to answer is, how might we design and implement innovative solutions to improve the lives of those with long COVID today? To help focus people's submissions even further, there were 3 tracks or thematic areas for which folks developed ideas, design proposals, and finally design prototypes for. Those 3 tracks are People First, which focused on providing solutions that create safe, responsive, and supportive conditions for people with long COVID to more fully engage in the world around them. Raise Public Awareness, which focused on creating and disseminating educational materials to help increase the public's awareness of long COVID in order to build greater understanding and empathy for people suffering from it. Strengthen community support for those living with long COVID, focused on designing resources that improve the quality of care and life for people living with long COVID. And those resources could be for patients, caregivers, healthcare providers, clinicians, and other partners. With that, let's meet our 15 finalists, who I'll be introducing in alphabetical order by project name. Adaptable, a workplace hub to help employers better understand long COVID and provide accommodations, from Cambria Dumasnell. Augmenting wearable metrics with outcome data, fatigue tracking among long haulers, from PhysioForecast Inc. Building the world's largest data set on long COVID, from Strong Haulers Inc. C19 LAP, patient-developed long COVID model of care, comprehensive long COVID care centers, from COVID-19 Long Hauler Advocacy Project. Empowering patients through AI-driven symptom monitoring for long COVID, from Sarika Mulukuntla and Divya Chandana. EchoCare, an integrated upskilling platform to bridge gaps in long COVID care for marginalized communities, from Joel Yap. Long COVID Care, Customized Aid and Resource Explorer, from Summit Consulting, LLC. Long COVID Care Directory, from Starlight App Studios. Long COVID HCP Discussion Guide, from Pandemic Patients. Long Hauler ID Card, from Sarah Stern, Trudy Wonder, and Leah Schultz. Long COVID Studies, a website to help people with long COVID find and enroll in research studies, from Ezra Spear. Storify, elevating lived experience with long COVID, from Elizabeth Sanders, and Makama Malazada. Trial Pilot, Revolutionizing Medical Research by Empowering Patients Globally, from John Douglas. Voices of Resilience, Long COVID Storytelling Workshops, from Kristen Urquiza. We Want to Be Seen, Visualizing the Invisible Struggles of Long COVID, from Megan Hughes. I'll pause here for a moment so we can celebrate our finalists. Feel free to react with an emoji or even come on camera to show your appreciation for their work. Amazing work. Thank you, everyone. And now, let's introduce you to our 3 winners, which I'll be announcing in no particular order. As our finalists know, part of their prototype submissions included creating a video that showcased their solutions. As I announce each winner, we'll be playing their videos to give you all a closer look at their work. We Want to Be Seen, Visualizing the Invisible Struggles of Long COVID, from Megan Hughes. And a quick note that this video has no sound. Thank you. Our next winner, Adaptable, a workplace hub to help employers better understand long COVID and provide accommodations, from Cambria Dumasnell.
Adaptable is an employer resource website to help them support their employees with long COVID. So this is available live at longcovidatwork.com if you'd like to try it out, and I'll walk you through it real quick. The site's broken into 3 categories. So starting with learning, building employer understanding and awareness of long COVID and the impact. Accommodation, giving them resources to support their employees who have long COVID, and then grow so they can build workplace knowledge and understanding and empathy for individuals with long COVID. So starting with learning about long COVID, it starts with defining what it is and the different terms that they might have heard for it. And then it gets into sharing some of the symptoms of long COVID, what their employees might be experiencing, and then really focusing on the people that are impacted and the demographics there based on the CDC household pulse survey data. And my favorite part is bringing in the human element from the Health Plus Long COVID report, sharing some of those stories, and then breaking it into 5 actionable things they can do based on that report and the Job Accommodation Network's guide that they have. And then moving into the second part of the site, it's accommodating. So it shares resources from the Job Accommodation Network, like a toolkit and free consultation that they offer. And then there is an AI idea tool. So they can go here, they can get different ideas of what accommodations might look like for an employee who has, for example, shortness of breath, and it'll give them ideas. It doesn't go into a whole lot of other things, so it helps minimize some of that risk generative AI can bring. And then the final section is growing their workforce's long COVID knowledge. So there are 2 prototype trainings. The first is focused on managers and supervisors so that they can better understand accommodation requirements and how they can make those happen. And then for employees, to really bring that empathy and understanding into the organizational culture and help them understand how they can support their colleagues.
Thank you. And EquiCare, an integrated upskilling platform to bridge gaps in long COVID care for marginalized communities, from Julie Yap.
Have you ever wondered why some individuals are denied proper health care simply because their providers fail to understand their needs? Consider the plight of over 17 million people grappling with long COVID, where people of color, bi and trans individuals, and women are disproportionately affected. EquiCare offers a solution rooted in design justice. Research by Health Plus and HHS shows that lack of long COVID knowledge and implicit biases hinder accurate diagnosis. EquiCare's certificate program addresses this with tailored courses like trans health awareness and long COVID care management. Providers earn badges symbolizing their commitment to equitable care and take quizzes for ongoing learning, fostering positive patient interactions. The report also found that distrust towards healthcare providers is rampant, with patients often not believed. EquiCare's provider directory helps patients find certified providers with expertise in long COVID and relevant cultural competencies, building trust and confidence in the healthcare system. EquiCare also offers internal tools for providers to track progress, improve teaching methods, and stay updated on research. Patients can chat with a clinic-designated care manager for personalized support and use AI for translation services to overcome language barriers. EquiCare has vast growth potential, with partnerships in clinics, hospitals, and medical schools. Its Care by Design apprenticeship program aims to diversify the healthcare talent pipeline in high-impact areas. Future plans include courses on other chronic illnesses and promoting health literacy in underserved communities. Eliminating disparities in long COVID requires valuing all populations equally, rectifying injustices, and providing resources according to need. EquiCare removes systemic barriers to achieve health equity, making health disparities a thing of the past.
Congratulations to all of our winners. I'll pause here so we can offer congratulations to everyone with an emoji, or again, if you want to come on camera to show some motion. Incredible work, everyone. Okay. Now, let's get to our wonderful speakers. To introduce you to them, I'd like to hand things over to Kathleen Carroll, who is lead designer and U.S. Digital Core Fellow at the Office of the Assistant Secretary for Health at the Department of Health and Human Services. Take it away, Kathleen.
Thank you, Anne. And I wanted to quickly echo all of the congratulations to everyone, including the winners, the finalists, all who participated, judged, spoke, supported us through this project. It's been a hugely energizing project to see the immense impact these proposals will have. And like Anne said, I have the honor of introducing our guest speakers this afternoon. And I'm going to start by introducing Dr. Susan Menares, who is the Deputy Director at ARPA-H, the Advanced Research Projects Agency for Health. Dr. Susan Menares is a globally recognized leader with more than 20 years of experience in health innovation. Throughout her career, Dr. Menares has focused on understanding the critical challenges within the health ecosystem and the greatest opportunities for innovation to meet these challenges. Prior to serving as ARPA-H Deputy Director, Dr. Menares led innovation at the Health Resources and Services Administration, focused on ethical use of artificial intelligence and machine learning to support improved health outcomes, novel approaches to addressing social determinants of health, expanding access to behavioral health, ending the opioid epidemic, addressing health equity gaps in maternal and infant mortality, and improving the country's organ donation and transplantation programs. Dr. Menares has also served at the White House as the Assistant Director for National Health Security and International Affairs in the Office of Science and Technology Policy, and as the Director of Medical Preparedness Policy on the National Security Council. Thank you, Dr. Menares, for speaking with us today, and I will pass the mic to you.
Thank you for having me. It is a pleasure. I loved seeing all the finalists. First, I want to say congratulations to everyone who became a finalist. Those were absolutely fantastic initiatives. And I know, ARPA-H runs challenges like this as well. And it's always really hard to select from so many incredible products and so many incredible people who are contributed. And so congratulations to everybody. Congratulations to the 3 finalists. Those are exemplary initiatives, which I can just see the impact that they're going to have. And so congratulations to you as well. I want to talk a little bit about why I wanted to participate today, and that, ARPA-H, for those of you who don't know it, it's one of the newest federal innovation organizations. We fund research and development. And one of our core missions is to try to look to see where there are opportunities that no one else is funding, whether it's in such a complex area as long COVID, or whether it's all the way down to trying to make sure that we have a way that patients that are not integrated fully into the healthcare ecosystem due to systemic disparities, or just the fact that they don't know how to get the right help. We want to make sure that we're investing across that entire spectrum. And we know that the public and the private sector play such a critical role that we want to make sure that, like this initiative, we get out and we say, what are the big challenges we're trying to solve, and how can we look to everyone to be able to solve those? And so we are funding, currently about $1 billion in activity across the health ecosystem, whether it's specifically on cancer care, or whether it's on changing the dynamic of payer models with our HEROES program, or whether it's in cybersecurity. We're investing across the full spectrum. And we really want to make sure that we have an opportunity to speak to everyone who's interested in the health ecosystem. And what I will say is we would look to you to also consider working with us. So many of the finalists and the winners, I love what you are doing. I love the innovation. I love the way that you were thinking about addressing these longstanding challenges with long COVID. And that's the type of performers that we're looking to incorporate into our performer base. I would encourage you to go to the ARPA-H website. We have so many different ways to work with us. We are actively recruiting program managers to come into the organization to help contribute directly to the programs that we're funding. We have an open call for innovation where we are seeking investigator-driven ideas for novel products, novel capabilities to help address some of these longstanding challenges in the health ecosystem. And then we're also pushing out big programs. So these are significant initiatives that we hope that when we fund multiple performer teams, will really change the dynamic and the trajectory of some of these longstanding problems within the health ecosystem. And so if you're not familiar with ARPA-H, please do go to our website, take a look at what we're working on, and then see if there's something that you're doing that would that actually would align with our mission space, whether you want to be a program manager or whether you want to seek funding through our open call for innovation or one of our programs. We'd be very, very excited to work with you. And like I said, ARPA-H, we have such a wide remit that we can essentially work across the entirety of the health ecosystem. So we aren't defined by specific diseases or specific tools or technologies, or even particular parts of where something fits in terms of the technology arc, whether it's a brand new initiative or whether it's ready to be have a go-to-market strategy. We'll fund initiatives across the entirety of that spectrum. The big areas that we're looking at are sort of health science futures, which is over the horizon. What is the next big innovation 10 years from now that we can seed now? Resilient systems. So how do we actually improve the resilience of our healthcare systems? Proactive health. How do we keep people from becoming patients in the first place? And then scaling solutions. So a lot of what I saw today, you probably, if you are one of the designers or the performers that developed it, you developed a prototype. You've developed something that serves a purpose for a limited group that has already seen it, used it, and said, this is amazing. Our fourth domain of program is scalability. So how do we take something from initial prototype that has demonstrated impact, and we get a go-to-market strategy that actually will allow it to scale to all that would benefit from it. So I think there's a lot to like that we're doing that is complementary to this. But again, I want to thank the organizers for this challenge, and I want to thank all of you who made it to the final round, and in particular, Cambria and Megan and Joel. Congratulations! I mean, you were in the midst of some phenomenal work, and of course you rose above and were the winners this time. So congratulations, and I hope you will take some time, go to the ARPA-H website, learn a little bit more about us, and maybe we'll see you. Maybe you'll see you in our ecosystem. Thank you.
Thank you, Dr. Monterez. I see some virtual applause coming through. And thank you so much for demonstrating the path forward for some of these prototypes and projects, and some opportunities that might exist beyond the Healthathon. We really appreciate that. Next, I'm going to introduce our keynote speaker, Dr. Kristen Honey, and I'll read a quick introduction before sharing the slides. So Dr. Kristen Honey is the Chief Data Scientist and leads the team advancing Innovation X in the Office of Science and Medicine at the U.S. Department of Health and Human Services. Her team tackles complex challenges by harnessing the power of open data, open science, open source, open innovation, prizes, community science, crowdsourcing challenges, and public-private partnerships for health. Priorities include improving the community's experience with government services using the novel Health Plus human-centered design program and customer experience methods. Partnerships include LymeX Innovation Accelerator, KidneyX Innovation Accelerator, and COVID-19 Pandemic X Accelerator. So thank you, Dr. Honey. I will share the slides and pass the mic to you shortly.
Thanks so much, Kathleen, and huge thanks to all of our speakers, participants, and winners, and what Dr. Monterez said about making sure that we recognize everyone. I believe there were dozens and dozens of submissions early on, and we just heard from the 10 teams down selected to 8, but there were dozens of excellent ideas that we hope to continue incubating with you all, and hopefully deploying to market. One of the values of these sprints in the open with the public is we're demystifying HHS. So through this process, hopefully many of you now know folks on the inside, whether Dr. Ian Simon, Kathleen Carroll, myself, so we can continue helping to get your solutions to market. And with that, I want to just highlight our long COVID innovation and tackling wicked problems together. What do I mean by wicked problems? I am from Maine, so we say wicked awesome a lot, but this is actually a social science definition from planning, city and urban planning back in the 70s, where they saw complexity in some challenges that they deemed to be wicked problems. And solutions may not exist. These may be intractable problems, but by working on them, we can make them better. However, given their interdisciplinary nature, we need to cross silos, we need to engage multiple disciplines. And by focusing on the problem and working on it, we're probably changing the landscape and the ecosystem. And so it's a dynamic thing. So wicked problem means highly complex, and solutions will rely on all of us. And even if they defy solutions, we can make it better. So my team, we like to lean into these wicked problems. We call ourselves Innovation X, thinking of X like a variable, where there are many different types of innovation, and sometimes an agile sprint or open innovation, crowdsourcing solutions like we did with this Long COVID Healthathon is the right tool, but we have many, many different approaches to challenges. And what we do with our team, we visualize catalyzing healthy futures for all through science and innovation. And that word catalyzing is key because our team does not run any programs. Really, we're a catalyst and we get in and out. Everything we take on has an exit strategy. So our success is working ourselves out of a job and having the momentum, having the program and the project live on beyond us. How do we do that? Foundation of almost everything we do is data. And you can think of HHS or federal data as a strategic asset. And as we manage our data in different layers of stewardship and who can access the data, what should come out one side of this pipeline is open data by default. So if it's government funded science, or if it's data about how government operates, or results from federally funded research or lab to market, you, the American taxpayer, should have free access to that information because you've already paid for it, as long as it doesn't violate national security or compromise personally identifiable information, and the benefits, the perceived benefits to the public outweigh any potential risks to privacy or other types of risks. Our data should be open by default. And all of that data can be fuel for many different types of solutions. And you'll see in this pipeline, open data fuels crowdsourcing. It fuels tech sprints like this innovation sprint, the Healthathon. It fuels grand prize challenges like our LymeX grand prize challenge. So think of open data as a fuel that the HHS pipeline, we are designed to make it open by default. So some of these methods, and Kathleen has done a fabulous job with this Long COVID Healthathon of putting together our methods in kind of a unique way for this Healthathon. It involved collaboration with the public, collaboration with CoForma. It involved prize challenges in terms of putting out criteria of what are we looking for in a solution? What's the call to action? And then having clear evaluation standards, and on the other side, giving out cash prizes, very fast-paced innovation sprint. So this Healthathon really mashed up a lot. One of the most important things that it did was use the human-centered design and put people at the core. And this is the portfolio that Kathleen has done such a great job of leading, but we think of it as people first and innovation for impact, where we engage, we exchange ideas through those repeated engagements where consistency over time can build trust. We hope by building trust and reaching across different silos, different disciplines, and acting together, we can hopefully come up with novel approaches, new solutions, and then together iterate and adapt them. And then when things work, our office can then pass the baton to other programs that scale programs or have the resources to take things big. We just heard from ARPA-H, so +1 to checking out that website and all those resources, but that's the kind of handoff our small little team will do so that some of these innovations can really scale 10x and beyond. Now, within Health Plus, there's, we're specifically focusing on long COVID, the wicked problem. This tool, or this suite of tools in the Health Plus umbrella really has been instrumental for us at HHS and the department to understand long COVID in new ways. We've heard how it affects so many people, millions and millions of Americans, and each experience is unique. And science is rapidly changing. It's a new condition. A few years ago, the world didn't even know about it. So we're all continuing to learn about it. And in that approach, the Health Plus, approach of human-centered design, putting people and the lived experience at the core of understanding, and then elevating that to be on equal footing, equal facet, a different type of facet, but not less than, just different, and a new way of knowing to bring another element to the solution with the MDs, the PhDs, the policy wonks out there. We all have a piece of the solution. So with CoForma's help, last year, there was over 1,000 hours of qualitative and quantitative research that rolled up into this report. And out of that, many, many anecdotes, your individual experiences that you shared with the department and with CoForma were rolled up into personas and journeys that make it much easier for us policymakers to respond with action, because one individual anecdote can bounce off a big system as like one person's story. It's just an anecdote. But if you wrangle hundreds, thousands, sometimes millions of those stories, all those individual anecdotes actually become a signal through the noise, and you can respond to it as rigorous data. So that's sort of what this Health Plus approach does, is transforming dozens of individual anecdotes into through qualitative, quantitative mixed methods into personas and into more rigorous experiences that represent not just one person, but an amalgamation of many, many common experiences. And in the report, you'll see lots of quotes. There's so many great ones to pull from. They're heartbreaking because they're so true. But if we don't speak truth to power and admit the extent of the problem and know, how where people are falling between the cracks, where government and services could do better, we can't fix it. So these individual quotes are so important for the Health Plus report. And this one, coordinator and advocate, and the insurance specialist, also the patient. And patients just want to get well. They just want to get their lives back and feel, 100% again. So they don't have time to play all these other roles. So how do all these stories roll up into journey maps? This is a journey map of what it takes to get diagnosed and a treatment journey. This looks fairly straightforward. It's still complex. You still have to visit specialists, but you do get symptoms resolved at the end of this journey. That, unfortunately, is not everyone's experience today. And having many dead ends, going through loops, seeing the wrong specialist, getting kicked back around, many shared their experiences with us, then rolled up into this map that turned into pain points that then make it easier for us on the policy front to respond to. So all of your expertise really helped us to zoom out, what's the problem, so that we're designing the right thing, and then converging on solutions like our this healthathon did, and then diverging again, where we started the healthathon with ideating. You all are on the front lines. You all have the lived experience. You all know long COVID in a unique way that complements and augments our understanding at HHS. So what are your ideas? And then through this healthathon and the winners today and announcing the 3, we're converging on delivering some of those solutions. So as you saw earlier, $25,000 in cash prizes is going out to these 3 teams, but there are many winners beyond just the cash prizes. Over 300 folks engaged, gave feedback, over 200 user profiles, over 40 solutions submitted, 15 finalists, and the 3 you heard today is just coming out one side of the funnel. Now, how we did the work is as important, if not more important, than the work we did. And how Kathleen ran this is an ethos that we're going to carry forward in our future long COVID work and affecting other portfolios we have, from long COVID, Lyme disease, and infection-associated chronic illnesses. So what's this ethos that we do? People first, data always. People at the center of solutions. All solvers are welcome. That means it can sometimes take longer, but with that trade-off of very diverse teams and all perspectives welcome, we get more robust solutions. And with robust solutions come solutions that stick and change that lasts. And the healthathon, as you all experienced, was a data-driven approach to innovation with a bias for action. Let's do a prototype, let's implement, let's test it, let's do another iteration. So that approach, and we learn through acting and shipping our results, sharing our results, getting feedback in the open, and doing that in a space where we're co-creating with patients as equal partners. Before I take it, I just want to give one kind of a shout out to our 3 winning teams again. Saw the videos and Adaptable. Congratulations. The Want to Be Seen, transforming the invisible illnesses into something visible. And when it's visible, we can respond to it and do better and provide better services and acknowledge and hopefully make those patient journeys and experiences better in the future. Congratulations. And then EquiCare, the upskilling and bridging the gaps in long COVID care and beyond only long COVID for other conditions, to help improve how society serves marginalized communities and all of us. So congratulations to all of our winners. And I just want to end on a few notes that Kathleen and the US Digital Corps that has sent designers to federal agencies, including our office at HHS headquarters, what they've really taught us in their short 2 years with us. And we're very excited to continue these collaborations. But important thing is co-creating solutions. And co-creating isn't just a buzzword. There's a whole rigorous science behind this. And there's actually open government partnership, participatory standards and co-creation standards that we at HHS have been holding ourselves accountable. But the idea is that open government and all of our government should be more accessible, more responsible, and more accountable to you and the citizens we serve, and improve the relationship that we have between our government and the people, who our government is supposed to be serving for the long-term benefits for everyone. And so co-creation really puts the emphasis on the relationship. So it's a two-way ongoing exchange. And there's not us in government doing this for the people. It's us doing it with, as an iterative, and our role in government is to create the space, provide a safe space like the Long COVID Healthathon did online, for new dialogue, new ideas, new perspectives, all the voices to be able to come through and have that space, safe space to be heard and lifted. And then we can scout and put a spotlight on the challenges that are most pressing pain points. And then eventually through our iterations, put a spotlight on what works. What are the promising solutions and the bright spots? And then by putting a spotlight on it, helping connect it to the resources, and in collaboration with other parts of the department, other agencies, scale some of those solutions. So our role is really about facilitating solutions. And one thing Kathleen has really shown us is how important it is to find the why, our shared purpose, and then stay humble with open minds, because the best solutions come from unexpected places. Then move while we act, get feedback, stay open to feedback, and iterate together. So with that, you have our commitment that this will be an ongoing dialogue, and we will continue working in this people first, data always. And no matter where the next sprint takes us, or future collaborations take us, please always remember that you, each of you out there, is the experts in your own lived experience. You are going to know more about your own experience than anyone else ever. And wherever there's scientific controversy, and there's been a lot of debate and controversy of long COVID and infection-associated chronic illnesses, our medical science and establishments have much, much more to learn. But wherever there's controversy, that's a signal that we need more data. We need more data and discovery, because science and data are going to be our way out. But let's do that science and data with people at the core and iterating together, and then truly harnessing the power of the crowd, your wisdom, your lived experience, by using the human-centered design methods and everything that Kathleen has brought to our portfolio, US Digital Core, and we're increasingly seeing across federal government with this push for customer experience and improved citizen services that put the individual citizen at the center of our government processes. So with that, I'll end on the long COVID wicked problem, and that all of us and us at HHS headquarters, we give you our commitment that we will continue to have radical inclusion, because we see it as a moral and ethical imperative, that all the voices are heard, including the lived experience, the patient experience, the caregivers, and we all can be a part of the solution, with industry having unique contributions, nonprofits having a unique role in solution space, academia leading the edge in science, and again, patients, advocates, all of you being a part of this solution. And all of your entries today have rolled up into this, but it's not the end. This is the beginning, because through this process, you've learned how to pull back the curtain on HHS, who some of the people are, and Kathleen, myself, all the people you've met through this long COVID journey. We're here to help you take your innovations, your ideas to the next level. So please do not hesitate to reach out. Know that this is an ongoing conversation and a long COVID commitment, and we will continue solving this wicked problem of long COVID together. Congratulations, everyone, again. Thank you for being a part, and onward. Much more work with long COVID remains, and we look forward to working side by side with you to co-create the next generation of solutions together.
Thank you, Kristen. I see some more virtual applause coming through, some confetti. I have to learn how to do some of these Zoom reactions. They're really cool. I just wanted to thank you, Kristen, for your guidance and support throughout this project. I know that it's been invaluable to me to really learn how to put on a kind of program like the Long COVID Healthathon, which has been so impactful. Like Kristen said, I want to kind of echo the sentiment to keep in touch and keep us on your radar as you continue working on these projects or projects in the future. We have a profile on X, formerly Twitter. It's at HHS Innovates, and that's where we'll post any future opportunities for things like challenges, innovation sprints, or any future engagements with the public. We'd love to have you participate in any kind of projects that we put on in the future. And we also have our email here, longcovidinnovation@hhs.gov. That's an inbox where you can send any questions or concerns that you have about this project or any feedback as well. We're all ears. We want to continue supporting you in these projects. So if there's anything that we can do, please don't hesitate to reach out. And with that, I thank you all for attending. It's been such a wonderful project to work on and to lead, and I wanted to give a final congratulations to everyone who participated. But that is the end of our programming, so that concludes what we have for you today. But thank you all once again, and we'll say goodbye.